Today, yeah, Mental Disorders 101 and explain us. This was an ambitious talk. I thought this would be a good idea because as I, in my work as I go across campus and all the things I do, people often say to me, so what exactly is a mental disorder? And so do you think I have an anxiety disorder? And do you think there's something wrong with my child? I suddenly realized that although there is so much information about mental health, that maybe we're actually forgetting to tell people just some of the basic information. So what I'm going to do today is hopefully answer some questions, bring some things together, and provide some explanation. Now, this is a very ambitious task to do because there are many different types of mental disorders. So I will be focusing mainly on the anxiety disorders and the depression disorders. But let's see how we go. These are some of the questions I hope I will be able to address today in this presentation. For those of you who have been with us, this is our 15th year of this public lecture series, so thank you for your attendance. It makes me very happy to see you here time and time again, so thank you. All right, so a few key points. Mental disorders are actually present at all stages of life, right? So they are present in young children right through to the elderly. 1 in 7 people have a mental disorder in Australia, right? 1 in 7 is really common. So I think sometimes we talk about mental disorders as though they're this thing, but it's like, no, it's right here. It's all around us. We all have friends and families and relatives and neighbors who all have a mental disorder. In fact, because mental disorders are often triggered and exacerbated by life stress, half of everyone will experience a mental disorder at some point in their lifetime. This is not a thing that affects some people, not others. Like most people will actually experience a mental disorder at some point. Most of the time, though, these mental disorders will present earlier in life, right? So generally, people will experience their first mental disorder sometime before the age of 21. About 75% of cases arise before the age of 21. We'll talk about the fact that mental disorders can wax and wane. So you might have one and it might go away and you may never have it again, or it might come back at another point in life. Or having one type of mental disorder can make you at risk for another type of mental disorder when the next of life stresses comes along. Anxiety disorders and depression disorders are the most common disorders. I'll show you some graphs, and that's why we're going to focus on that today. Now, why do we worry about mental disorders? Well, partly because if they're left untreated, we know that they're associated with many negative consequences. Or it causes poor physical health, right? Depression interacts with cardiovascular risk factors, right? So it actually increases the risk of cardiovascular problems. We know it increases the risk of mortality. We know it increases the types of medications you're going to have to use, the number of hospitalizations you're going to have. It costs the health system a lot of money when we leave mental disorders untreated. And it might not be because of the mental disorder per se, but having a mental disorder increases the chance you'll have a physical health disorder, which then means you're going to need more and more medical care. We know that untreated, it affects people's workplace performance. It affects their education and schooling. It affects absenteeism and dropout from study. We know that also is involved in poor marital relationships, reduced friendships, and social isolation. So there's lots of reasons why understanding mental disorders is important. Now, one of the key messages I wanted to talk about today is just for you to understand that mental disorders very much mimic everyday experiences. And I think this is why it can be really hard sometimes to know what is a mental disorder. So, for example, when we think about depression, we know that people who are depressed are very sad and gloomy. We all get sad and gloomy at points in our lives, right? So how do you know when it's depression? One of the anxiety disorders, generalized anxiety disorder, is about excessive uncontrollable worry. Again, we all worry at some point, and there are times in our life when that worry may seem excessive and uncontrollable. So does that mean it's a mental disorder? Many people are nervous about public speaking. Social anxiety disorder is a condition where some people will experience significant experience about social public speaking. So again, when is it a mental disorder? Children are often afraid of the dark or separating from parents. Is that okay, or is that a mental disorder? What happens if they're afraid of the dark or separating from their parents when they're 21? Is it then a mental disorder? Adolescents can be irritable and unmotivated. That can mimic signs of depression. Okay, so I think you get the point, right? So this is sometimes really difficult to differentiate because the symptoms are also a normal part of experience when they are not part of a mental disorder. So there are some things that we do as professionals to try and distinguish between when something has become abnormal or a mental disorder and when it is still part of the normal experience. Some of the questions that professionals have to answer is their experience of what they're going through more than we would expect for their circumstance, more than we might expect for their peers? Is it appropriate for their age and their life circumstances? So when workplace stress happens, are people who experiencing stress more than their colleagues? These are the keys. Are the Year 12 students who are stressed? Yes, they'll be stressed. Are they excessively more than their peers? That's often when we're starting to see some clues. So I'm going to give you a definition. It's not my definition. This is a definition of what a mental disorder is. And this comes from our Diagnostic and Statistical Manual of Mental Disorders. We're going to talk about the classification of mental disorders in just a minute. So the definition here is that a mental disorder is a syndrome, is characterized by clinically significant disturbance. It has to be in someone's cognition, emotion regulation, or behavior. And that needs to reflect an underlying dysfunction in their psychological, biological, or developmental processes. I hope that makes sense, right? So it's all clear now, right? What makes a mental disorder? That's a mental disorder, okay? Mental disorders also are usually associated with significant distress or disability and impairment in social, occupational, or other important activity. Down the bottom, I've tried to give you more of the key words about what's going on. So a mental disorder is more likely to be the case when the distress is sustained long periods of time, right? Weeks and months without a break. It affects the functioning. That functioning can be at work or school or friendships. It's more than peers, more workplace stress, more Year 12 stress, more anxiety than a child or other children. It needs to affect cognition, behavior, or emotion regulation, and it needs to be caused by dysfunction of processes. And I'm going to tell you about what some of those processes are as part of the presentation. So there are mental disorders are basically described by a classification system. In fact, there are two main classification systems. The one we predominantly use in Australia is called the Diagnostic and Statistical Manual of Mental Disorders. We're up to the 5th edition. Okay, there is a classification system called the ICD-10, well, ICD-11 maybe now, International Classification of Diseases. That classifies all health conditions, of which mental disorders is a chapter, right? It's a component of that, right? Now, they're literally a book. They're a sick book, all right? They describe what each mental disorder is, what the symptoms are, how long you have to have had it, what it's related to, sometimes a little bit about the causes. It's like, tells you everything about mental disorders. And I've just put some examples here. These books are organised into chapters where they group disorders together that are quite similar in their presentation or perhaps in their cause. But if you've ever been confused about what a mental disorder is, this is kind of why, because there are so many different types. They change their names sometimes, right? So we had now called persistent depressive disorder, was once called dysthymia. Dementia now is actually a major neurocognitive disorder. Manic depression is now bipolar disorder. So sometimes disorders change their names. Sometimes the symptoms we think belong to a particular disorder change with the revisions come around, which might be every 10 years or so. So if you've been confused, that's part of the reason, all right? Because it's a very complicated system. We know that a lot of these disorders co-occur. So if you've got one, it's likely that you might have a second one, which is often why sometimes it's hard to get a diagnosis and an accurate diagnosis, because these things interact with each other. But a lot of these disorders, as you know, can be overlapping and quite similar, right? So sometimes people get, I think, frustrated when it's hard to get a diagnosis, but this is why. It's actually quite a complex classification system. So I'm going to talk to you a little bit about differences in prevalence and rates of mental disorders. So this is child data. So this is the Australian Child and Adolescent Survey. It's the second survey that was done. And this is just prevalence of typical child-related disorders. And we can see anxiety disorders, depressive disorders, ADHD, so attention deficit hyperactivity disorder, and conduct disorder. And what you can see here is that of all the mental disorders that occur in children up to age 11, between 4 and 11, ADHD in boys is the most common presentation that we'll see. You can see that by the blue line there. And it's followed by anxiety disorders, which are quite common. All right? If we look at what happens in adults, so this is from age 16 to 85, you can again see here anxiety disorders, which is the light blue bars, are the most prevalent of the mental disorders. All right, then we have mood disorders in the dark blue, and substance abuse is listed on, or substance use rather, is listed on this particular graph. So again, you can see anxiety disorders more common. We can see that we're seeing more of them in the midlife. Some decreases happening, it seems, later in life. And if we look at this particular survey, which is a US survey, which looks at individual anxiety disorders, and we're going to chat about what some of these are in a minute. But what I wanted to show you here is that you can see that there are some anxiety disorders which are more prevalent than others. So social anxiety disorder, which was once called social phobia, as per the slide, is one of the more common anxiety disorders. And it turns out that that presentation is most common right throughout the age range. It's a very prevalent anxiety disorder. The other anxiety disorder that's really prevalent are phobias, specific phobias, right? So phobia of heights or dogs or blood or airplanes or trains. Phobias in general are very common right across the lifespan. You can see here too that some disorders are more likely to occur at different stages in life. So if we look at generalized anxiety disorder, which is the GAD there, we often see a bit of a peak in the prevalence of that disorder, often occurring in childhood, or you can see in midlife. Separation anxiety disorder, which is a fear of separating from parents or can be from home, typically doesn't occur much later in life. We see it much more in young children, and you can see that by midlife it starts to really decrease, and we don't see much of it after about the age of 45. Right? So there are differences in what mental disorders are present at different times. Now, the interesting thing is that I said to you before that most mental disorders will have occurred before the age of about 21. We know that having one disorder can make you more likely to experience another. So children who have had an anxiety disorder, there's a 50% increased risk of them developing depression as an adolescent. All right. Children who have ADHD are at increased risk of developing later externalizing disorders, which are things like a substance use problem, right? Or gambling. So we often see that, it's good to treat the first mental disorder because it can often go on to, become another one later on. I guess the key point is that mental disorders are common. They're common at every age group. Yes, they do change a little bit in prevalence at different parts, but really mostly it's more same and then different. And we definitely know that earlier intervention, the better. So you might remember that when I told you about the definition of mental disorders, I said that these symptoms had to have some kind of disturbance in these cognitive, emotion, regulation, or behavioral processes. And I bet you know what those are. But in case you didn't, I'm going to talk a little bit about what they might look like. All right. So when we think about cognitive processes that underlie mental disorders, we're talking about worry, excessive, uncontrollable worry when you just can't stop it and will not go away. You might just try and distract yourself, but it just comes back. It wakes you up in the middle of the night. Paranoid thoughts are an example of cognitive processes. Having racing thoughts that you just can't stop. So not worry, but just thoughts that are constantly really, really fast. Having difficulties with your memory is a cognitive process that might underlie a mental disorder. When we think about behavioral processes, they can be things like hyperactivity in the case of attention deficit disorder. It could be avoidance, particularly common in anxiety disorders or PTSD. It could be compulsions, which is what we see underlying obsessive compulsive disorder. It could be binge eating or restrictive eating, which of course underlie eating disorders. When we talk about dysregulation in emotion regulation, we're talking about maybe uncontrollable angry outbursts that are really frequent and excessive for the situation. It might be changes in mood, frequent crying, excessive fear. And it might be physiological responses, so things like panic, muscle tension that just doesn't go away, gastrointestinal symptoms or fatigue, and many, many others, right? And so most mental disorders are a collection of these things. Most mental disorders have elements of each of these things together. And so psychological interventions often spend a lot of time trying to target each of these processes. So we certainly, in terms of what causes a mental disorder then, we know it's very much this interaction between nature and nurture. So we know that genetic vulnerability does play a part. We know that mental disorders tend to run in families. Anxious mum and dad, pretty good chance you're going to have an anxious child, not guaranteed, right? So often when we are inquiring about someone's mental disorder status, we'll ask about family history to understand who else in the family might have what and what that presentation might, because that starts to give us clues about the type of presentation that might be in front of us. We know that there are some biological causes too. So some mental disorder symptoms can be induced by medications. We know that hypothyroidism, for instance, might be a biological cause for depression, and of course neurotransmitter disturbances and other sorts of biological factors might play a role. And on the other side, what I've got there on the right-hand side are what we might call predisposing factors. So these are things that make you more vulnerable or interact with those genetic and biological causes to perhaps kick off a mental disorder or to exacerbate something that was there before. And so very much we know that stressful life events are key. So whether those were stressful life events in childhood, right? So, maltreatment in childhood, for instance, can be a traumatic event. So suddenly a car accident, a major fall, a major illness, or witnessing something where someone else was hurt, suddenly developing a chronic health condition or having chronic stress, for instance, at work, or chronic financial stress, having a relationship problems, right? So these are all things that can kickstart a mental disorder for someone who might in the past not have had a mental disorder, or it might exacerbate a mental disorder that was already there. It's also why we often see mental disorders pop up in stressful times, but also at times of transition in life, right? So postpartum depression, of course, appearing, after a birth of a child. We often see depression can follow a period of bereavement after a death of a relative or a friend, and change in employment can often be another key reason where we see a kickstart in the presence of mental disorders. So in terms of parenting factors for young children, we know there are things that parents can do that can increase the chance that child might develop a mental disorder. I'm not going to say they cause it, but they just contribute to, right? They're not guaranteed. So things like parents who are less warm, parents who are overprotective, helicopter parenting, we know can make it more likely that a child will experience anxiety. But parents who have very harsh punishment routines or give their children too much autonomy, actually, can also be associated with behavioural problems in youth, all right? So crime and conduct disorder problems. We know the social environment's really important, right? So low SES neighbourhood, growing up in a neighbourhood with a lot of crime, a lot of violence can also increase risk for children. And then the temperament, so how inhibited you might be, or if you have what's called callous unemotional traits, which is that difficulty to actually be empathetic and show remorse. So there are the things that cause mental disorder and others, right? So it's pretty complicated. And it's also why studying psychology is so great, because we get to study all these things and understand what all these interactions might be. So what are some of the, so we talk a little bit more about these processes, right? I know this is a little bit techy, we're going to move on soon, but just for those of you who are interested, these are some of the processes that underlie mental disorders. And in psychology in particular, we spend lots of time studying these processes. We conduct experiments and surveys. We try and manipulate these variables to try and work out cause and effect, because by understanding what these processes are is how we develop new treatments. Right? We go to the cause, we work out what is it that's causing it, can we stop that cause or change that cause, and voila, you get rid of the mental disorder. That's the idea, right? So we know that, for instance, there are a lot of attentional processing biases and memory and cognitive biases that occur in mental disorders. So you might be like, well, what is that? A processing bias or a cognitive bias is about how we process information in our brain. So we see something, we hear something, how do we interpret that? What sense do we make of that information? Well, different people will interpret information in different ways. It depends on and kind of lens they look at that information through. And that lens is shaped by those early experiences, by those genetics, by the stresses they might be experiencing. So for instance, it's actually really interesting that if you were to show an ambiguous bit of information to someone, right? It might be an ambiguous statement. It might be something like your GP calls you up and says, I need to see you for an appointment. It's not urgent, but don't leave it too long. Right? It's like a nice, ambiguous phone call. Now, if you are more anxious, where's that going to take you? Right? So what we know is that people who are more anxious are going to very quickly, they're going to assume the worst. They're going to look for the threatening information in that. They're going to catastrophically start to imagine all the worst case scenario that's going on. Those who are less anxious will think, oh, that doesn't sound quite very good. Wonder what that is. Oh, well, nothing I can do about it, so they know. And they might actually be able to hold still some anxiety, but a relatively low level of anxiety until they get to that GP appointment. And of course, sometimes GPs then say something completely trivial and you think, gee, I wish you'd just said it was nothing when you left the message, right? So anyway, we know that people who have an anxiety disorder or anxious prone, they do tend to have this bias towards processing any information in a more threatening and negative way. In depression, we have similar things happen. So people who have depression or predisposed to depression, when they look back in their life, they can more easily and quickly recall negative memories over positive memories. It's not because they necessarily have more negative memories. That's just the distorted perception that is the cognitive bias in their brain. If we were to give people lists of words, maybe half negative words, half positive words, those who are more predisposed to depression will remember more of the negative words than the positive words than someone who's not depressed, right? So these are the sorts of processing biases that we study, which give us clues about what might underpin a mental disorder. I might stop because I could go on and on and on about those. So in terms of behavioural disturbances, so in anxiety, we see a lot of avoidant behaviour. We're going to talk about that in a moment, where anxious people tend to avoid going to situations which they feel are going to make them stressed. That turns out to be not so good. It actually maintains and makes anxiety worse. Obviously, in externalizing disorders, we see behavioural responses of impulsivity, right, or hyperactivity, which then make people vulnerable to substance use, chasing novel sort of stimuli, doing silly things like, making silly choices and risky choices, right? So understanding behavioural processes is important because we then often target these in treatment. In terms of physiological arousal, we know that some people might have heightened or dampened responses. We're going to talk a little bit about the sympathetic and the parasympathetic nervous system in a minute to explain what that is about. We talked about social factors before related to parenting and overprotective parenting. But also, I guess, here we see social skills deficits, right? Or social communication deficits that often underpin disorders like autism. And then, of course, there are biological responses too, which I alluded to. So neurotransmitter deficiencies and differences in brain activation. So we're not going to have time to talk about all of these today. We're actually going to talk a little bit about how they relate to anxiety and depression. So we'll use that as a bit of example. So I want to start by talking about physiological arousal and how that relates to anxiety disorders. So when we think about arousal, we often talk about when people get too aroused, their sympathetic nervous system is actually overly activated, right? So we know that when there is a danger in front of us, a genuine danger, not an ambiguous danger, we will perceive some sort of threat from that, and our body is actually tuned to detect that threat and then prepare itself to deal with that threat. And so you might remember hearing about the flight or fight response, which refers to this sympathetic or nervous system. So basically, the brain detects a threat, you get ready. Do I have to fight? Is something going to attack me? Or do I need to be able to run? And that's probably because historically threats came in the form of hippopotamuses and animals and other people trying to attack us or whatever it might, some sort of physical danger. So the sympathetic nervous system quickly activates at this particular point, prepares our body. The parasympathetic nervous system is the one that then turns that system off and returns us to relaxed state and one where we can go on and do normal processing of bodily functions and not being so worried about actually having to run. The problem with this system, though, is that it is actually activated whenever there is a perceived threat. So when that doctor made that phone call and you perceived a threat that the doctor's going to tell you some catastrophic news about your health, this system gets activated. If you have to stand up to give a public presentation, it's the sort of thing you don't feel very confident about and you're a bit worried you're going to make a mistake or people are going to laugh, this system gets activated. You sit down to do an exam, this system gets activated. Your husband's home late from work and you start to think, well, what is he up to? This system gets activated. Right, so this is the problem. This system gets activated with everyday psychological threats and not just when there's big hippopotamus chasing us. So to understand how important this system is in terms of anxiety disorders, we've mapped out here some of the symptoms that you might see. Now, these symptoms are genuinely relatively helpful if you have to run or you have to fight. Some of them are just consequences of the other parts of these symptoms being activated. So, for instance, your body will try and pump the blood to its extremities, so its arms and legs, so its major muscle groups are ready to do that fighting and fleeing. The downside of that is it means blood is redirected from your digestive system. So there's less time now being spent processing your food. So you can imagine if you stay in this state of anxiety for a while, it's why in anxiety you often will have stomach issues, right? Constipation, diarrhea, because your body is not spending its energy and time on the processing of food because it's so ready to fight or to run. Blood clotting occurs because we're preparing ourselves for potentially being injured. Our heart rate increases. The blood starts to pump through our body because, again, we're getting these large muscles ready to fight or to flee. Our mind becomes alert because we actually are better at scanning and looking for the danger, right? We're actually ready to protect ourselves. But the problem is that when you're alert all the time, you feel on edge all the time and you can start to feel a little bit tired, right? So we do get some of that fatigue. It can be hard to concentrate. Having the right amount of stress is actually super helpful at different times. This is a slight side story. Year 12 students sitting for the exam, moderate levels of stress activates that mind alert, which is a very helpful thing. It's what you want in an exam. Elite athletes use to maintain moderate levels of stress because they want that blood pumping to their arms and legs. They want that little extra boost. So there's a sweet spot for this, right? Moderate level of stress can actually increase performance across a range of tasks, cognitive tasks, physical tasks, right? Too much stress, definitely not so good. Too little stress, if you're in a performance situation, is not that good, all right? So there are good things about this system. Breathing rate increases, right, to increase the level of oxygen. That can mean that you feel dizzy. It can give you chest pains. It can make you feel lightheaded and panicky. The sweating might occur because that is ready to cool your body because you have all this extra blood in your arms and legs, etc. All right, so this is a system that underpins anxiety disorders, and this is one of the things we try and target when we're treating people. I'm going to talk about panic attacks and how they relate to that system actually in just a minute as well. But basically, in a panic attack, that is just that system maxed out, right? So when we think about different sorts of cognitive factors that might underpin mental disorders, we've been talking a little bit about those processing biases that people might engage in. We also know that there are different ways that people might think about the world, right? So we talked about the fact that in depression, for instance, people will spend a lot of time thinking that their world is full of negatives. They tend to think about their past in a negative way. They think about their current time in a negative way, and they think about their future in a negative way. And they also believe they have less ability to cope with those stresses. So they are cognitive factors that we then target in treatment. In anxiety, there's an anxious thinking style. People who are anxious, or when you're feeling anxious, you tend to overestimate how likely it is that something bad is going to happen. You're sure you're going to fail that test. You're sure you're going to stuff up the job interview. You're sure that girl is going to reject you on the date, right? We think it's very likely that something bad's going to happen, and we overestimate how bad it's going to be when it does. Right, so when I make that mistake in my speech, I'm not going to do a little stumble and move on. I'm going to drop my deck of cards. I'm going to say something really simple and everyone's going to laugh. Everyone's going to tease me afterwards, right? So we exaggerate the consequences and, again, underestimate their ability. Behavioural processes that underpin mental disorders that, again, we then go on to target in treatment. We know that it's common in mental disorders to avoid situations due to fear, right? Seems like a good thing at the time. Just don't do the speech. Don't ask the girl on the date. Don't go for the promotion at work. But actually, it maintains the anxiety and obviously has all those other consequences as well. We know that excessive reassurance seeking can make you feel good. It can make it feel easier to cope with your worry. But the problem is when you're constantly seeking reassurance, it undermines your own belief in your ability to cope. Checking behaviours, right? People often, when they're anxious, will check. It might be checking the ovens off in an OCD point of view, or it might be just making sure they control everything and make sure everything's checked and perfect so that when people come for the lunch, everything's done. I've got the knives and forks, I've counted the chairs, and I've got the serviettes, and it can be really exhausting, right? So these sorts of things can maintain these mental disorders. Social withdrawal is something that happens regularly in mental disorders. Of course, people often do it to try and cope with the depression or the feelings of loneliness, but it actually maintains and makes those problems worse. There's obviously social skills deficits I mentioned before, and others, impulsive behaviours disorders, eating as examples. So now that we've covered what causes mental disorders and how prevalent they are and what are the processes, I thought at this point it might be good to tell you what an anxiety disorder and a mood disorder actually is. All right, but I wanted you to know that first because I hope now some of this will make sense. So there are quite a lot of anxiety disorders. I've put just the most common types there, you can see. But anxiety disorders are all characterized by this marked fear or anxiety. So it's excessive fear, it's excessive anxiety. It's not everyday anxiety and everyday worry, it's excessive. And it has to also have some of these behavioural features I was talking about, right? So typically that's avoidant behaviour. So trying not to come into contact with the feared stimuli, try not to go into the feared situation or not to have the thought that's really worrying. So common types, and you will have heard of some of these. Generalized anxiety disorder is uncontrollable worry, essentially, about many different topics. Social anxiety disorder is a fear of negative evaluation. So giving speeches, meeting new people, being in groups, performing on stage, going and swimming at carnivals. It can be all sorts of things. As long as the fear is about being judged negatively by others, that's often a key part of social anxiety disorder. Panic disorder. Panic disorder is a fear of having a panic attack. We're going to talk about what that is in a minute, because having a panic attack is not a mental disorder. Only the fear of having another one is the mental disorder. Phobias, common, can be animals, situations, natural environments, others. There are probably hundreds of different phobias. Separation anxiety disorder, fear of separating from a parent or home, and agoraphobia, so a fear of open spaces or enclosed spaces where your fear escape will be difficult or embarrassing. And so you can see on the right, all of the different sorts of typical symptoms we see in anxiety disorders, and they're all of those things we're talking about with the flight or fight response. Shaky, stomach problems, sweating, fatigue, difficulty concentrating, etc. I'm not going to go through all the disorders. The different disorders have basically different numbers of these types of symptoms you might have to have, or certain collections of them. Some of them say a problem might have to be present for 6 months, or it might be for a different time point. But basically, this is what anxiety disorders look like. So in terms of social anxiety disorder, we think about what are those, cognitive, behavioural, physical components that we were talking about, the processes. So in social anxiety, which again is one of the most common, and it's the same whether it's younger kids or older people, but we see they think people are going to judge me, I'm going to make a fool of myself, right? Whether that's going on a play date, whether that's whatever it might be, dressing up in costume. They avoid doing those things, right? So they avoid speeches, meeting new people, performance situations, or they might only do those things under certain circumstances. Like, I'm happy to meet new people as long as they're a female, right? I'm happy to go and join a group as long as there's not too many people in the group. I'm happy to go to the party as long as I can stand at the door, right? So they often make these rules up to try and help themselves feel safe in social situations. Obviously, they feel fear and nervous and embarrassed, and obviously have those physiological symptoms, but often we see in social anxiety racing heart, sweating, blushing, and shaking. And generalized anxiety disorder, this is one that we often see people present for treatment. Excessive, uncontrollable worry. They're the people who worry all the time. They worry about everything, right? So in fact, to meet criteria, you have to worry about at least 3 different topics. So worrying about the fact that work is really difficult is not enough. Worrying about your finances is not enough. You have to have multiple things you're worrying about all the time. So typically worrying a lot about something bad is going to happen. It's going to be terrible. I'm not going to be able to cope. Lots of avoidant behaviours, lots of reassurance-seeking behaviours, lots of checking, right? That checking might be checking blood pressure multiple times. It might be checking financial records multiple times. It might be checking the news all the time. It might be calling someone all the time to see where they're at and how long before they're going to be home. It can also be over-preparation. So over-preparing for having people for lunch, over-preparing for a presentation, right? These things are what people do to cope, but they're also the same things that unfortunately maintain their mental disorders. So in terms of emotions, uncontrollable worry, fear, and again, you'll see some physiological symptoms there as well. The generalized anxiety disorder presents very similarly right across the lifespan. Obviously, younger kids are often a bit more worried about friendships. Older people are more worried about world events. But same sorts of things. So I had said that we were going to talk about what a panic attack is, so I quickly thought I should tell you about panic disorder before we move on to depression. So panic is those symptoms, you can see them there, and really it's just about having really intense symptoms that escalate within a couple of minutes. It's quite normal. People get them sometimes when they're giving a presentation. People have them in PTSD. So it can often come up. It's only a problem if they are recurrent and people fear having the next one. Depression. All right. So depression is low mood, but it's constant. It's consistent. It's day after day, most of the day. It doesn't go away. right? And so different disorder types, some require for 2 weeks being present at a very intense level. That's for major depressive disorder. People can also have what's called dysthymia, which is not quite as intense, but longer duration, at least 12 months. We often see this associated with changes in sleep and weight and appetite. It can also include, of course, thoughts of death. A major depressive disorder, we've touched on already, but lots of negative thoughts about themselves, the future and the past. And we see lots of behavioural withdrawal, more time in bed, not socialising anymore, giving up their hobbies. And of course, those things actually go on to maintain the disorder. So we'll be finished soon. I just wanted to touch on a couple of treatments for mental disorders. You will have heard of these, right? So cognitive behavioural therapy is a psychological therapy. It is the recommended first line of treatment for mental disorders. This is what people should do first before they do anything else. Highly effective, been used for over 50 years, many clinical trials. And in this, people are taught skills to change those thoughts, change those behaviours, change those physiological reactions. Obviously, there is psychopharmacology. So when people take drugs like antidepressants, for instance, these basically target deficiencies or changes in levels of neurotransmitters, which are basically brain neurochemicals that the brain uses to process information and to pass information through. And then, of course, there are other sort of more modern ones that they're only really recommended if the other two fail. All right, so if treatment's been ineffective. So what is CBT? Yes, it targets those cognitive processes and behavioural processes. So let's have a little look at that. So in anxiety disorders, we teach people to change that threat perception. We teach them to stop thinking that they're in danger. We try and bring it back to a little bit more realistic about, well, how much danger is there really and how much could you cope, rather than letting them catastrophize and get too far down the track about how disastrous it's going to be. And we target behavioural strategies by getting them to face their fears. All right, it's called exposure. Key fundamental part of challenging anxiety disorders. People go, I don't want to do that. I'm afraid of spiders. I don't want to go see a spider. Well, if you want to get over your anxiety disorder, your phobia of spiders, that's actually what you need to do. All right, that's okay because therapists are lovely and they will do it with you very slowly and step by step. Mood disorders. Again, teaching people to change their thoughts about themselves, their future, and their past, and increasing their activity levels and solving problems. So how do we change people's thoughts? Anxious people are thinking something's going to happen, there's going to be disaster. Depressed people are thinking things never work out for me, nobody wants me. We often teach them to ask questions, helpful questions. Is it really likely to be true? Have I had experiences like this before and it didn't turn out the way I'm predicting right now? Will it really be that bad? Have other people coped in my situation? What else might happen instead? Have I been in this situation before? And did I worry like this before? And what happened last time? What situations have I coped with before? What would a good friend say? Right, so psychological treatments are very practical and in some ways very simple, but they're highly effective. So depression, I talked about withdrawal, so we try and get people to redo things, right? They're now in bed, they're avoiding their friends, they've dropped out of their hobbies. We get them back doing those things slowly, step by step, one activity at a time. Get you outside, have a cup of tea in the sun, get you to call a friend on the phone, get you to go out for coffee, and then slowly back to increasing engagement with hobbies and other things. All right, so again, very simple things. We talked about exposure, getting people to practice facing their fears, facing their fear of heights, start with small heights, get bigger. Public speaking, start by talking to friendly people and then work your way up to more speeches perhaps. Doesn't really matter how it's done. It's basically, it can be fast or slow. It's facing the fear. That's a really key thing. So just to finish, want to say, of course, you know that here in the Lifespan Health and Wellbeing Research Centre, we've developed a number of these cognitive behavioural therapy programs, which we now use regularly for children. We know we can treat anxiety and mood disorders really successfully. Our Cool Kids program, you're probably aware, is used in over 25 countries, right? Highly effective. And you can see it teaches exactly the skills I'm talking about now. Our Study Without Stress program is just for kids who are really stressed when they're in year 11 and 12. Same skills. So we know that teaching kids these skills can actually prevent kids from getting overly stressed as well. We have programs for the elderly, our Aging Wisely program. Same thing, same skills, just taught in a way that's appropriate for older people as well. And all of these established through clinical trials. So if you're interested later, these all have QR codes and you can follow the links to read more about them at home. So of course, if you need help, if you know someone who needs help for mental disorder, there's lots of places you can go. I've listed some here, talking to GPs. There's free digital treatments via MindSpot. You can have a look, right? There's a whole range of programs they have available there. We have our emotional health clinic, of course, here, which offers telehealth and digital health services right across Australia. Don't really know about us, you can. I think that might be my last slide. Other than to say, of course, please stay connected with us, and there's all the different ways you can stay connected.